It is truly a pleasure to be here. And despite the fact that Dr. Wren told me that Monty Python references dated me, I like to include things that are fun for me. And if they're fun for you, that's an added bonus. I don't have any financial disclosures. I'm going to talk a little bit about entrustable professional activities, although that's not the main focus. And I will disclose that I am a champion and facilitator for the EPA project of the American Board of Surgery. I also want to tell you that I have an active practice of gratitude. I've been doing this for quite some time. And 3 things that I am grateful for today. Number one, anytime that you have a chance to be introduced by Mary Hahn twice in a 6-month period, that is truly something to be grateful for. I'm grateful to be able to be here. As Mary said, this has been rescheduled several times, and I have many friends here on faculty, as well as trainees, current and former. And I have a connection to the Kovitz lectureship. You heard about their Midwest roots, but the connection to Norman Shumway, whose daughter Sarah Shumway was one of my mentors during my residency and the only female that was on faculty when I trained. So these are my objectives, and you can sort of skip to the end. The last one is the most important one. And hopefully, you will either learn something new or it will awaken you, stimulate you to commit to doing one new thing with respect to feedback in the next week. So the goal of what we do most of the day when we come to work is to train the next generation to become surgeons. And so we are, in a sense, giving away the keys to the car. This works in a couple of ways. It's scary, right? Those of you who have taught a teenager to drive, that's a little scary when you finally give away the keys to the car and hope that there isn't a crash. My most recent experience, I have 20 nieces and nephews, and the one who is the youngest, within a week, crashed her car. Was fine, but the other thing that handing over the keys to the car makes me think about and reflect last night to the very fancy new car that I got to ride in of Dr. Wren's. Think about when you learned to drive and the car on which or in which you learned to drive and the car that you drive now. The car you drive now is a lot more complicated. It's got a lot more bells and whistles. And so what we are teaching is a lot more complicated than what we learned. There's more to know, there are more techniques, and hopefully that translates into there are more things that we know about education. And so relying on the way that we were educated to educate the next generation, while it might be okay and we'll get there in the end, there are better ways to do it. So I come to satisfaction with feedback and talking about feedback and evaluation from a place of growth. I will tell you that the satisfaction with feedback or providing appropriate feedback is the second most common citation that is given by the Surgery Review Committee. First is related to work hours. And this is my resident survey. And I will tell you 45% is not very good. That's not my current resident survey. But this journey towards trying to improve feedback and evaluation is a personal journey and one that we have had to take at OHSU. And because I know that you are likely better than this, but because it is such a common citation, it is something that I believe that all of us can learn something about. So what is feedback? Well, it actually comes from trying to keep a rocket on course. And the rocket gets feedback not only to tell it when it's going awry and going to end up in some distant place, but when it's on course. And early learners will do things by accident that are correct. And if we don't tell them and give them feedback that what they just did was the way that we wanted them to do it or the right way, the next time they do it, they might by accident do it incorrectly. So the old surgical aphorism, if you will, if you don't hear anything, you're doing a good job, that actually doesn't work. If you want somebody to be intentional and repeat something that is correct, you have to give them feedback that it was correct. So this is hard. Feedback and evaluation are hard. It's rocket science. And think about some of the reasons why it's hard. And we do it all the time. Well, in a setting where there's a power differential, feedback is taken as evaluative. So it's not just that I told you that the port needed to be placed 2 centimeters to the left. It's that by telling you that, somehow I am telling you that you are a bad resident or you have less worth. If you tell me that my manipulation of the scope is inefficient and I need to follow more closely, somehow I take that as you think badly of me. It's not recognized as feedback. Well, I mean, I just told you something about your performance. You ought to know that that's feedback. Well, we may not actually understand that what I have told you or what I have just been told is feedback that is meant to be taken in a performative way. You may not actually think I know what I'm talking about. And so if you get feedback from me and you don't think I know what I'm talking about, you're not actually going to engage with that feedback. It's not going to have much value to you. The feedback that you get isn't consistent with prior experiences. You just got some feedback from Dr. Spain. It was absolutely counter to feedback that you got from Dr. Hahn yesterday. Well, then what are you supposed to do with that? And so do you throw out the feedback from Dr. Spain? Do you throw out the feedback from Dr. Hahn? Do you just get frustrated and kind of go on and do your own thing? Most of the time, people do the latter. They're like, well, they can't both know what they're talking about because they just told me the exact opposite. So I'll just move on to the next. The feedback is delivered poorly. Wrong setting, wrong words, wrong timing, giving feedback after a very long call shift, giving performative feedback after a difficult patient experience, rather than giving some time for emotions and more of a debrief and separating. And not wanting to give performative feedback when you know that somebody is trying. And concentrating on the effort, concentrating on the positive aspects, and it is absolutely important to give positive feedback and to frame things, but to concentrate on the effort when the actual performance needs improvement. So there are, and this is by no means an exhaustive list, but it is hard to do this correctly. Because every one of these things, feedback can be given in every one of these, using every one of these examples, and it's not particularly helpful feedback. We also tend to think of feedback as something I give to you. That's my job. I am an academic faculty. It's my job to give you feedback. Well, it's actually a partnership or a two-way conversation. And it works so much better if you tell me what you want feedback on during this particular interaction. Then I can give you goal-directed feedback. It's not that I might give you some performative feedback on some other aspect of the interaction, the operation, but I will pay specific attention to what you have told me you want to focus on. This actually is also the best way for faculty to get feedback on their teaching. And that is a nut that is really, really difficult to crack, because the experts on how well you teach are sitting right there. And if you want to know how well you're doing, you're working with somebody for a week or a month or however long your rotations are, halfway through, sit down and ask them. So one of the ways to think about feedback and to put this in perspective is to use a Johari window. And if you look at the y-axis, it's about what others know about you, whether they know it about you or whether they don't. And if you look at the top x-axis, it's what you know. So the things you know and other people know, that's public information. Think of this about in terms of your learning environment. The things that you know and other people don't know, those are the secrets you keep. So Dr. Wren might not know that lap choles are my absolutely least favorite information. And every single time that I walk into one of them, my heart rate goes up about 20. And so it is difficult for me, that is the most difficult case in which I grant autonomy. And if I don't tell her that, there's no way she's going to know that. And so when I'm a little jittery with a resident in that case, if I haven't said that, they're not going to know. So the things that you don't know and other people know, that's what you're blind to. And then there's things that you don't know and nobody knows, and we don't know how to figure that part out. But this part is about feedback. So things that I don't know, but you know about me, that's what I need help with. That's what I need you to give me feedback about. And the things that I know, but you don't know, that's the self-disclosure part. And if we bring those two together, if I tell you what I need feedback on, because there's no reason that you're going to know that, that's what I carry, then you can give me feedback about my performance. So let's get into giving feedback. And yes, Dr. Spain, I did include my Princess Bride reference. So from the Princess Bride, my name is Inigo Montoya. You killed my father, prepare to die. This is the model for the actual feedback conversation. He's unfailingly polite. He always introduces himself. He gives a statement of fact from his perspective, and then he gives an expectation. So if you construct your feedback in that way, unfailingly polite, introduce yourself or the topic, give a statement of fact from your perspective, and then the expectation that you have after you give your statement of fact. So feedback should be goal referenced. That's the self-disclosure aspect. So again, you are free to give feedback on pretty much anything, but goal referenced and goal directed feedback is the most effective. Feedback should also be actionable. Telling me to be more efficient or giving me feedback that I'm not particularly efficient, while it may be true, I don't know how to become more efficient if you don't give me more specific feedback. That's particularly important when you're giving feedback to early learners who are by their nature inefficient because they've never done this job before. And so very concrete, actionable examples are helpful, whereas more generalities, while they may give some information about how frustrated you are, they're not helpful to the learner. Feedback should also be timely. So given as close to the event about which you're giving feedback as possible, understanding that there are times that feedback is not appropriate. When you're not able to concentrate fully, at the end of a long call shift, either you as the person giving feedback or the person that is receiving your feedback, having made that mistake multiple times in the past, not a good time. It needs to be ongoing so that interactions that repeat, you can give feedback about whether there has been improvement. And it also needs to be consistent. And that consistency runs two ways. So if you get feedback from Dr. Wren on Tuesday, and you do the same exact thing with Dr. Wren on Wednesday, you should expect that her feedback should be the same. It might be graded if you've made some improvement, but she shouldn't turn around and tell you to put the ports in a completely opposite place than she told you on Wednesday. The consistency also is important that it crosses people. And we need to give the same feedback to Taylor that we do to Josh, that we do to Steve, that we do to Mary. We need to be consistent across gender. We need to be consistent across race. We need to be consistent across ethnicity. So EPAs actually work and align with these important aspects of feedback. They have behavioral anchors, so they are goal referenced and goal directed. They provide progressive autonomy. Those behavioral anchors are actionable to move from one level of autonomy to the other. They have to be directly observed in order to function or to be able to give feedback, so they are timely. And they are required, they will be required as of July for certification, so they are ongoing and goal referenced again. So some more tips about giving feedback. It needs to be named. Specifically call it out. I have some feedback for you. Now that sounds silly. I'm giving you some information. Of course you think it's feedback. Of course you're going to recognize it as feedback. It's kind of insulting that I think that you need to tell me I'm giving feedback. Of course you're giving me feedback. I'm going to give you some data in just a second to show you why it is so important to specifically call out, I am giving you feedback. You need to own it, and that's the statement of fact from your perspective. I observed you do this. When you did this, it gave me the impression that that may not have been your intent at all. And that's okay. You may not have had that perception. And actually another person in another behavioral dyad might not get that perception. But the fact that I did is an important piece of information for me to give to you. It should be balanced. Again, think about that rocket. 50% is reinforcing, making sure it stays on direction. 50% is redirecting, getting it back on course, and none of it should be detrimental. And then when you have given feedback, check how you've been heard. Did what I say make sense? Because quite honestly, it may not have made any sense at all to the person to whom you're giving feedback. Think about the number of times you have talked to a patient and thought that you've explained absolutely everything, and you use the teach back method, and they come back with something that does not resemble in the least what you thought you said. Same thing happens in a feedback dyad. So it's a two-way conversation, right? So there are tips for giving feedback or good ways to giving feedback. And the same thing is true for receiving feedback. Feedback about you, think about that Johari window. Feedback about you is yours. That is information about your performance. That is information to help you grow. It's yours. So you absolutely should ask for it. And then engage with it. You may not think you may not think it has much value, but somebody took the time to give it to you. It's a gift. So engage with it. Think about why somebody gave you that piece of feedback. If it doesn't make sense, ask questions, seek clarification. And then indicate or think about what you're going to do with it. When you get feedback that is constructive or indicating in some way in which you could be better, most of us, our first reaction is, I don't know what they're talking about, or it's because I was this, it's because I was tired. Avoid all of that negative emotion and negative reaction. Again, this is a gift, and it is being given so that you can ultimately drive that car. So I'm going to give you a couple cases. And none of these are current residents, and none of these are Dr. Cunningham. This is a resident that I was resuscitating a trauma patient with. So we get pre-notification, like many places. 38-year-old involved in motor vehicle collision. Blood pressure was 80, pulse was 140, Glasgow Coma Scale score was 15. So this is a PGY5 resident who took the team, did a preoperative huddle. When the patient got there, placed an emergent chest tube, had an appropriate plan of care. Once we were out of the resuscitation phase, had a team debrief. Did this absolutely in a stellar manner. Absolutely, I wouldn't have needed to be there at all. patient got great care. The team functioned well. Didn't order any blood. This patient, hypotensive, tachycardic, absolutely needed blood. Didn't order any blood. Now, at the time, we were piloting entrustable professional activities, and we were a site that was using the trauma EPA. And activating a massive transfusion is part of the behaviors for a trauma EPA. So when I gave feedback to this resident, I was able to say, didn't order any blood. And he said, oh, yeah, that's right. We had the same shared mental model. It allowed me to direct the feedback to give him that constructive aspect. And it was performance-based. Didn't have anything to do with whether I thought this resident was a good resident or a bad resident. And so when I gave him the formative entrustment decision that he was entrustable only for direct supervision because there was no blood ordered, he didn't take that in a bad way at all. Moved on. And the next trauma resuscitation and all of the subsequent ones, he ordered blood. So I use this as a way to separate a good resident, bad resident from a, which is oftentimes the feedback that that happens, and the difficulty in separating performative-based feedback from your opinion about the resident's general performance to a behavior-based, in the moment, just in time feedback that is really designed to improve performance. This is the second case. I got an email with some concerns about the technical skills of a resident at one of our affiliated sites. So, and I was told that this was the consensus of opinion of all of the faculty at that site. The rotation director had difficulty giving specifics and said that the resident was a really hard worker. And so they were sure that it was going to get better, but I just wanted you to be aware. Well, that's not particularly helpful feedback to me. And then when the rotation evaluation came in, there were no mentions of concern, none. So this is the rotation evaluation, the resident evaluation that the resident will see. All of the areas of patient care were rated as appropriate for level. The resident got some verbal mid-rotation feedback that was in the vein of concerns about technical skills, and then married that with the evaluation that she got through MedHub, and was incredibly frustrated. I know this because of conversation I subsequently had with her advisor. And this is a screenshot of that evaluation. Were you asked to complete any procedure feedback forms? So there was none of the bidirectional communication, no formal evaluation of technical skills. Was the feedback provided to the resident at the mid-rotation point? Yes. Was it provided at the end? No. So we instituted some formal operative performance evaluations. We use Firefly. Some places use Simple. Some places have other ways to provide operative feedback. Multiple faculty, several per week. 3 weeks later, so a very short period of time, significant improvement, and the resident's outlook and mood improved. And so I use this to show how inadequate end of rotation evaluations are, and relying on, well, of course the faculty are going to tell the resident and give specific feedback. And the the importance of structures and processes to drive that feedback. And again, I think this is where the EPAs can help, but certainly driving operative performance feedback when the concern is technical skills made the difference, at least in this situation. So another tool that we have available to us to help from a structure and process standpoint drive feedback is an educational timeout. So this is a formal stop. Just like in the operating room, you have to do a timeout before you do any operation. This is a timeout that's related to education. It can happen the night before. It can actually be started by email. It can happen at the scrub sink. That's the sort of the old thought. The actual reality of our life now is that we're rarely at the scrub sink at the same time as the resident is, or at least in my world. And so that doesn't always work. But at some point, have an educational timeout before the operation so that you can have some of that two-way conversation. You can understand which aspect of the operation or which aspect of a family meeting, which aspect of ICU care the resident wants feedback on. So a lot of this comes out of work that Heather Lillimo did at Vanderbilt. And she spent quite a bit of time formalizing the educational timeout among the residents and faculty at Vanderbilt. And after they had done this implementation work and implemented the educational timeout, she surveyed residents and attendings about how well that it had worked. And she actually got an amazing response. 348 people responded. And you can see about equal residents and attendings. And the benchmark that they were going for was implementing the educational timeout at 50% of the interactions. So the very quick survey that she asked was, did it happen? Was it educational? And who started it? So the attendings thought that it happened 3 times more often than the residents did. The attendings thought it was educational 3 times more often than the residents did. And the attendings thought they started it and the residents thought they started it. So to me, this speaks to we have to name it when it happens so that all of us understand that we're going through the same thing. And this is a remarkable comment on our educational environment and the perceptions that all of us have that are so different when we are going through the exact same thing. I'm going to switch gears just a little from feedback, which is a formative aspect of evaluation, to summative evaluation. And this, to be quite honest, is what I think I get most of the time from summative evaluations. Yeah, this went really, really well, love it. Yeah, it was fine. This was pretty horrible. Even summative evaluations need to have some guidance and some specificity. So how many times, just think about how many times in the last week, when you've been giving feedback or receiving feedback, it slanted to the left. Might have made you feel good. Makes you feel good giving it. Makes you feel good hearing it, unless it's the last one. But it doesn't help. other than, I mean, it is helpful to feel good. I mean, that creates a positive learning environment. That's probably a talk for a different day, but it doesn't help us get better. Whereas the information on the right helps us get better. So evaluations do need to happen at the midpoint of a defined interaction. So mid-rotation, so that summative evaluations at the end don't come as a surprise. Use achievement and not value-based language. So did a good job, that's value-based. Achieve the objectives of the rotation, that's achievement-based. And it should not be a surprise. You should not be writing anything in an evaluation that comes as a surprise either to the faculty, the rotation site director, or to the resident. If you find yourself writing something that you think will come as a surprise or a shock, that is an opportunity to do better the next time. So this is the OHSU version of the New Yorker cover, and I put it here to remind us that we give feedback differently to women than we do to men. And although the data aren't there to the same degree, we give feedback differently to people of color than we do to white people. It has to do with our implicit biases. It's important to recognize those. And it's why when you anchor to goal-directed feedback and written goals and objectives, you are slightly, at least, less likely to do that. So frequent formative assessments can provide a summative picture. That's particularly true for the areas of medical knowledge, patient care, and communication. So that end of rotation evaluations or summative evaluations can be focused more on behaviors that are better assessed longitudinally, like integrity, entrustment, teamwork, leadership. Many of these qualities that are really important in surgeons are hard to assess in a single interaction. And so if we can rely on something like EPAs to take care of assessing medical knowledge, patient care, and communication, we can spend less time as faculty evaluating those from a summative standpoint and focus more on these longitudinal areas. So this is what, if you collect frequent formative information, what a summative picture might look like. So you have a resident whose formative assessments cluster around indirect supervision. So we can say that resident for that particular EPA, it might relate to trauma, it might relate to biliary disease, is entrustable at the level of indirect supervision. And that comes automatically from the formative assessments. I don't have to do anything to come up with this information. Another resident or another EPA, the formative assessments cluster around direct supervision. And so I can make a summative decision, an entrustment decision at the level of direct supervision. And you can see another one might cluster at practice ready. There are several pitfalls in giving feedback and providing evaluation. First of all, is the lack of clear expectations. So think back to The Princess Bride. Have an expectation about what should happen. They're not goal directed. So you really wanted to know or wanted feedback on your dissection of the critical view of safety, and I gave you feedback about your port placement. Well, that was a wasted opportunity. It's non-specific. You did a good job. That's nice. I give you feedback tomorrow about something that happened a month ago that you can't remember. It focuses on summative evaluation when formative feedback is actually necessary. It assigns value. It's not viewed as a dialogue. And you can come up with a whole bunch of other pitfalls, but these are some of what I think are the most common. It is also really, it's critical, it's a necessary condition that in order for feedback to happen, the environment has to be a psychologically safe space. So if I don't feel as though it's a psychologically safe space, I'm not going to be willing to disclose to you. If I don't feel that it's safe for me to disclose that I need feedback about a particular aspect of an operation or leading a family meeting, because then you're going to think less of me, or you're not going to let me do it. If I don't feel safe saying that, I'm not going to say it. And I might not take your feedback particularly well, and I might not interact with it particularly well. Or you might not actually feel comfortable giving me feedback if it's not a psychologically safe space. So this is a necessary condition for any of the rest of what we've been talking about for the last half an hour or so to occur. So in summary, feedback and evaluation are related, but they're not the same thing. It requires an intentional focus. It doesn't just happen. It is a two-way conversation, and all of us in this room are responsible for it. There are several formal tools: educational timeout, a pre-brief, something that you have developed, your way of doing things, emailing the night before, EPAs, the Simple app. It takes reflection and commitment. And it gets easier with practice. So I'd like to thank you for your attention. I'm looking forward to the rest of the day spending time with you, and I am happy to take any questions.